Hi, everyone. Thank you for joining our presentation on the quest for better kidney care in multicultural communities. This presentation is now being live streamed on YouTube and recorded for future viewing. I'm Molly Stroll with the One Lambda marketing team and the LA chapter of the Women's Employee Resource Group at Thermo Fisher Scientific. This event is sponsored by the Women's Employee Resource Group and the Latino Hispanic Heritage Employee Resource Group as part of Thermo Fisher's efforts to foster a diverse team and an inclusive culture. Today, I have the great pleasure of welcoming Carolyn Lemos-Urquidez, president and founder of the Kidneys Quest Foundation. I'm also pleased to welcome Katie O'Leary to help moderate this session. Katie is Thermo Fisher's Yammer Community Manager, as well as the Communications Pillar Lead for the Latino Hispanic Heritage Employee Resource Group. Before we jump into the discussion, I'd like to share a little background on Carol, the Kidneys Quest Foundation, and the incredible impact they're having on the renal disease community. For the last 13 years, the foundation has been supporting kidney patients and their families in the US. Carol launched the foundation in the San Fernando area of Southern California, and today they're rapidly expanding with offices and networks in California, Washington, Georgia, and Florida. The foundation is designed to help people focus on building inner strength and learn how to take steps needed to manage their health condition. Carol and her team have developed a broad array of programming and have served over 33,000 patients. They've identified over 27,000 individuals at risk for kidney disease and have helped them get access to support groups and education. Some of the foundation services include giving guidance on next steps after a patient is diagnosed with a kidney disorder, offering dialysis support, helping patients with transplant list and qualification and support, giving information to friends and family members on how to become a living donor, providing classes and coaching on how patients can stay healthy and active for a better quality of life, offering a listening ear to patients who are struggling with fears of living with kidney disease. And now, since the onset of COVID-19, providing the community with supplies and most recently access to vaccines as well. So I'm really excited to get started and learn more about Carol and the Kidneys Quest Foundation. Carol and Katie, welcome and thank you for joining us.
I'm going to start off the questions here. So Carol, in the past week, I've had a great time just reading about your foundation, and we had a chat on the phone last week. Obviously your passion for helping kidney patients is really evident and very inspiring to me. And I was just curious where that came from and what inspired you to start the Kidneys Quest Foundation.
Well, it all started around 2003. It's being a minority, it became real within my own family and my own surroundings, friends, family, in different eras. One was genetic, diabetes and high blood pressure, different ways of ending up in end-stage renal disease. And me, as being in the healthcare for so many years, I was searching for answers. I went to international companies. I went all over to find answers. And one day I sat back and said, wow, there's nothing out there. There's a need here. There's a need of bringing awareness, direction, support. There was a huge need for people, not just people that can get on the computer and do everything I did I stomp the grounds when I go after something. But bottom line, it was for people that couldn't and didn't know how to get there, like minorities. And I'll say people, the language barrier, the underserved, the uneducated, that's maybe just went to 6th grade, coming from different states. There's a lot behind it, and I wanted to help in that area. Our team wanted to help in that area. We have a lot of great people that have brought it to that point.
Oh, very cool. I'm going to share a slide here with our audience. Hope you can see this. So Carol, I was wondering if you could tell us in a little bit more detail about your programs. It sounds like you have a very broad array of programs and that are very hands-on with patients. So we'd love to hear a little bit more from your perspective about them.
Okay. Support in directing patients. Wow. Once a patient gets diagnosed from the doctor, from the team, that you have end-stage renal disease, that's all a patient hears. The professionals are sharing everything, but literally when they come out, all they heard is that they're going on dialysis. So what we do as a foundation, we take them by the hand. We give them a lot of educational information. We support them one step at a time of getting it put, into their mind of this is what's going to happen in the future, in the near future. So they're prepared when their healthcare team comes in and starts telling them everything they're going to do. And they feel confident, they feel good, they feel ready to at least understand what their steps are going to be in a end-stage renal disease condition. Then we introduced options of potential types of dialysis. Patients come to us not understanding. Well, they gave me two options, Carol, and I said, okay, let's go over both of them. What we do is we just share and educate and show them the videos and show them what options they have. And bottom line, they make the decision with their healthcare team. But they understood at least. And we all know in the healthcare, they are a great team out there. They're doing the best they can, but they have thousands of patients, hundreds of patients. So how can we expect them to really do everything that we're doing as a foundation? So we look at ourselves at that link to the healthcare. And we work a lot with social workers of educating and supporting patients. We get a lot of referrals from social workers and transplant teams. And with that, we just continue on sharing with patients also how to become live donors, patients' family members, because a lot of patients come to me for questions about wanting to get on a transplant team. Yeah, that's great, but there could be a wait. So we introduce the possibilities of live donors within their families. We introduce options. We navigate to what's going to be best for them. And then we work with their healthcare team on that part, whatever they decide which way they want to go. On that part, we've had several events bringing awareness on becoming a live donor, and it's really a part of how soon they really want their kidney, or if they have family members or somebody that wants to donate a kidney. So there's a whole lot of scenarios there that we work with people and step by step in their journey. The next thing is eating with enjoyment. That's a great one. Up until last year, we started our cultural healthy meals for seniors on dialysis. That has been a hit. That has been something needed for a long time, but we got, I'm going to say we're honored to have the team that we have today to conduct this service. So it's a great thing. Exercising to stay active. That's a big thing because every patient wants to be on the transplant team, but they have to physically be ready too. And I come from a background of training of, that's another story of my life. Wow. And that part, I believe, in being healthy, you're ready for anything that comes in any challenge that comes in your life. And with the fitness, I believe that they build strength so they can get through even an 8-hour surgery of a transplant. Wow. So, and even just waking up in the morning knowing they're going to exercise, that's a mind, something essential that someone needs in their mind. Also, staying in control with a kidney disease. There's so much to know, and this is where the support comes in. There's so much that patients among themselves, and our support groups that we have every Saturday at 2:00, This is where patients dedicate themselves to each other. And it's only for patients. They get their educational topic, they get their kidney fit, and then their support group. But that's what they thrive for. They talk among each other from all over, because since the COVID, we had to go webinar. So now we have different people, different states on the line of individuals affected with kidney disease. And bottom line, these patients learn more from each other, and then they take it back to their healthcare team. So, and it's an honor. It's an honor to be part of it. It's an honor to be here as the stump, as being the part of such a great group to see these patients interact among each other.
That's great, Carolyn. I was going to actually pull out that part about the support group if you didn't mention it, because that was one of the things that leapt out at me on your website, because it's not just you and your team helping, but it's you guys introducing them to one another so that they can have that vital community. It's so key. I love that.
Yes.
You mentioned toward the end that your support group went virtual because of COVID-19, and that was our next question. So obviously it's an understatement to say that last year was a tough and challenging year, and that many people had to pivot and, figure out how to do things in a new way. And just would love to hear, obviously renal disease does not go away with the onset of a global pandemic. So how were you able to continue to keep the Kidney Quest Foundation going and serve these people in this time?
Okay. Now, this I get sentimental about. Okay. We have been, and I truly believe that we are the heart of the community of renal disease. And last year we had our annual Kidney Disease Impact Conference. It was a great impact. We had over 300 attendees. Cedars-Sinai came in and gave a phenomenal speaking engagement for us, and patients learned so much. But after that, a week after that conference, the pandemic hit. We got shut down. I literally looked at the computer and said, what are we going to do now as a community outreach? Well, being that heart of the community of kidney disease, I had to just sit back and listen to the heartbeat, the calls, the texts, people texting me, the emails, the need. That was the heartbeats. So after I started seeing and talking to the patients that were contacting the foundation, we literally put our gloves on. At first, it was a lot just me, because I didn't want to bring in the team yet because of the restrictions. It was hard to ask volunteers to do everything I'm crazy enough to do. But bottom line, we put our gloves on, all CDC restrictions, and we prepared, and we got out there to meet the need, which was, if it was cultural meals, we delivered to several regions, several dialysis units. We delivered up to 3,000 Stay Safe kits to patients.
What's in a Stay Safe kit, Carol?
Okay, a cloth mask.
Okay.
Hand sanitizers, gloves. These were items that they weren't able to get out of store because there was none left in the markets in Walmart, so they were getting feared because they didn't have access to it at home. Yep. So what we did was we prepared these, and the units were fantastic. I went to several dialysis units. They provided masks as much as they could every time they went to treatment, hand sanitizer. We worked as a team, us being the outreach and then being the internal, and we made it. We did it. And we still continue to deliver these masks and these kits by mail, and then now through after all that, we just in October, we were able to assemble 600 emergency Stay Safe backpacks. And that included, again, with the COVID hit, all the safety items, all the items that were necessary to be prepared for a natural disaster. And technically, this could be considered a natural disaster, So bottom line, we were focused on what we can get to the people. We now have a vaccination site. We
So
were
cool.
asked by the public health department, and we have a vaccination site every 21 days at our location. And when I say it's for the community, it's for the renal community, the community of minorities, of underserved, disabilities, and that's the mindset we had, because when patients started coming in bringing neighbors, kids, individuals that came to their home, they would be bringing them to the vaccination site, because we're all carrying who's getting vaccinated and who's not, because we all want to still continue to stay safe. If you decide to, it's a choice,
Right.
but we all want to be safe.
That's awesome. That's great.
It's not enough to vaccinate the patient. You really have to reach the whole community to keep the at-risk patients safe. It's key. Mhm.
Yes.
So cool that you not only were able to continue to provide the services that you did in this new virtual world we find ourselves in, but also that you actually got hands-on into serving like the COVID needs and now the vaccinations. It's just incredible. One more question from me before I move over to Molly, but you have offices in areas of the country that are known for their diversity. And I'm just curious about the types of patients and the multicultural communities that you serve, and the programs that you've started to meet their specific needs.
Okay. No matter where you go, and I've been to several states, and with programs from the Kidneys Quest Foundation, and anywhere I have been, you go into a unit, and I can say, I could be, a little off, but 85% of the patients are minorities in different cultures. Okay. It could be for several different reasons. It could be out of control diabetes, high blood pressure, again, genetic. It could be whatever reason it is. It's real. And with that, we continue to serve with the multicultural in a sense. And that's why we brought out that cultural meal program. Because can I share a little bit about this? I want to share about that.
Absolutely. Yes.
This program has been dynamite. It's been amazing bringing it to the community of renal disease, because when patients get diagnosed with end-stage renal disease, a lot of professionals come in with different parts of what their journey is going to have to do. And that's dialysis, what they can eat, how they have to eat it, and what amount. And bottom line, patients they have to accept the dialysis, the treatment, of course, and they look at the dietary, the renal meals as, I can't do that. These patients, especially minorities, cultural patients, they were not always ill. They became ill. They had a life before. They ate what they wanted to eat.
Right.
They enjoyed life, and food is part of enjoying life. I know for a fact, when I'm sick, and a patient, when they're being diagnosed with end-stage renal disease, they're sick. I know when I'm sick, I like to just lay down and eat the best food that I'm accustomed to eating. And to be honest, that's carne asada nachos, okay? And that's not good.
Yummy.
Okay, but bottom line, it's something comforting, and that's what they like. They're diagnosed with a lifetime condition that they have to live with the rest of their life, dialysis 3 times a week, sometimes every day, if it's PD. But bottom line, they look for comforting food, and that's why this culture meal program is so important. It's impacting the desire of something that they're used to having. Their cultural meals mean the world to them, and we prepare them with, of course, the requirements of the dietary specialist and analyst, and
That's great.
and being with the required intake of the fluid, the sodium, the potassium, the phosphorus, all the nutrients.
So you
And
take all the food that their comfort, their cultural comfort food, and you make them healthier for their new diets. That's
yes,
great.
exactly.
So it's easier for
We
them
have
to like transition.
Yes, exactly. Exactly. Especially the we've seen the oh my gosh, we launched out with the Filipino dishes and we've served over 200 already. And these patients, we, due to the CDC requirements, we meet at a local park right after the meals are prepared, and then we deliver the rest to the patients that cannot come out or to the dialysis unit. And it's amazing. I mean, they look forward to it. We have nothing but great feedback. You know, they even say, do you make this, you know, for future suggestions? And we take it back to the cook. And but bottom line, it's real. They find it satisfying for their soul. They find enjoyment that to eat, because before and I know because I have been around kidney patients so long, they say, you eat that. I don't want to eat that, you know, and they'll just pick at whatever they like. So making these meals, it's been so rewarding to see their faces. And when we deliver one, they make it to two, just so they have two good meals that week. And we've increased it to 2 times a week. And now they have 4 meals a week. So, because as we know, kidney patients they're not big eaters, especially after dialysis. They'll eat a little bit, but they do want to eat something enjoyable.
Yeah. It's great. Molly, on to you, I think.
All right. So, Carol, as you know, I'm a member of the Transplant Diagnostics business here at Thermo Fisher. And so something we're highly aware of is the fact that patients in multicultural communities often don't have equitable access to healthcare, including transplantation. So I'd love to hear what you and your team do to help patients learn about their transplant options, whether it be living donor or deceased donor transplantation, how you help them get on the waiting list and make sure they stay on the waiting list. I know we touched a little bit on this, but I'd love to hear a little bit more about it because it's very exciting for me.
Okay. Well, let me share something with you, okay? I had one doctor knock at my door at my office, and she showed me all her units and all her professionals in her units. And at the end of the day, she said, why do they call you the transplant queen? And I looked at her, I go, what, doctor? And she goes, and we started laughing. She goes, they call you the queen. I go, you know why? Because I take care of one patient at a time. And taking care of one patient at a time is taking one case at a time. Researching their opportunities and researching recommendations of that their case could possibly have. There's so much to share with patients. There's so many opportunities. It's just hard to put down on paper exactly what process to take. But all I can truly say is that every case has been different. And I, you know, right there, that's the biggest thing I can say, because patients, it could be insurance barriers. Yes, we work a lot with individuals with insurance barriers. A lot of cultural people from different countries come in and states that have emergency Medi-Cal. They have to look at, you know what, I'm on dialysis for life, but I'm grateful. I'll never get that kidney though. And that's something that, of course, I had to look more into research, and somebody heard our prayer. Okay, that's all I can say, because we're able to start. I've always looked at still being ready, no matter what barrier there is with patients. We still have other options to move the process going. In other words, if they don't have documentation, if they're not registered in the state of California, if they're not, we have to start looking for options. Do you have a family member? Getting them to the immigration office, starting their paperwork. Let's see what we can find that can help you. In the meantime, who can help you? What legal service? There's so much that we share. And you know what? The communities bring that information to us all the time. So we share what they have, and that's okay. My door's always open to share, because what's going to benefit this person may not benefit that person, but we have so many options. And I'm just that type of person that I look for answers. And I always say I'm stomping the grounds for the people, and they truly see it. And we communicate a lot. with each case. And even after the cases are completed, and even every time we work with individuals, they never forget us. And they go, Carol, how can we help you? Just by being you and staying connected with everybody, you know?
Yeah, it sounds like there's actually a lot of great resources out there for patients. But you guys, you and your team, and your foundation really serve as that hub to bring it all together so that patients who might feel overwhelmed by the process,
Yes.
you know, can find it all in one place. Yeah, that's really key. So another thing I wanted to ask about related to transplantation was you had shared a story recently with us about a patient who got a call that a kidney was available to them and almost missed out on the opportunity, but you were able to help them. Can you tell us a little bit more about that? Because I thought it was a really powerful story.
Oh yeah, yeah. That was a day. I did receive a call from her daughter. This patient, she was recommended to me from a transplant team. We had resolved a lot of processes through her transplant wait on that wait list, but one of them was her healthcare, and I had completed her case. So when I got the call from her daughter, she goes, Carol, my mom got the call. And I go, oh, great. And she goes, yeah, but they said that we only had till 5 o'clock because they said that she doesn't have this coverage. And I said, yes, she does. And so I had to put everything down that day and focus on this. I contacted the transplant team and the patient's daughter, and we worked together. And personally, I had to contact Medi-Cal, and I was on the phone with Medi-Cal, which they even heard my plea. And I've never, ever gotten this far with Medi-Cal, but I was literally on the phone with the Medi-Cal in Sacramento, where they actually put the database into the system. And it was amazing to have them on the line because somebody heard our plea of trying to help this patient and getting her that kidney today. And so with that, when they called, they said, okay, Carol, it's fixed. I go, hold on. So I got the transplant team on, the director of billing, and I said, check, okay, it's all fixed. Can you check the system? She goes, oh no, Carol, if you say it's done, it's done. I said, no. I go, get in the computer system and make sure she's covered because she has to get this kidney. She got called for it. She's been waiting for this day. And she goes, okay. So she got on it. She looked, she goes, oh my God, I have never seen this. She goes, who are you? And she goes, can I lock your name? Can I lock your phone number in my phone? I go, absolutely. I said, because if we could do this for one, let's do it for more. You know, but bottom line, it's real. The healthcare is a very big monster. And one day you can get the phone hung up on you, and the next day you get, but it's depending on the day it is and how much you put into it and what you do with it. But it's a lot of work. And she ended up getting her kidney. She went in at 5 o'clock and she ended up getting her kidney that night. So yes, that's what we do. We are truly the link in the community. Her daughter now volunteers for our foundation. She wants to just give back to the organization, just being there for her family. And it's hard because her mom, they're minorities and they struggle. You know, the mom relies on the daughter, has to work a full-time job. It's a lot. It's not as easy as people think it is, trying to get through with a condition and then get to where they really want to be in life in their condition. And that's more than likely transplanted.
I think, Carol, it really impresses me that you are such an advocate and that you're such a fighter. And like you said, you stomp the grounds. I think to me, that's the thing that stands out the most for me. And I just am curious, like, how do you keep up the energy? How do you, it must be, you must encounter hurdles every day. How do you not just say, oh, I'm done fighting. I'm tired. Have you always been like this from a child? Like, where do you think it comes from?
Okay. You asked, right? I had a great mother, first of all. She had a passion to help people. And I've seen her all my life. And then there's two great ladies in my life, and then my trainer. My trainer was a woman that truly helped a lot of people as well. I've had two great women that have
What
really
kind of
shown
trainer?
me.
Like a physical trainer? Like a
I,
fitness?
I actually was a professional woman kickboxer in the
Wow.
80s. Yes,
No wonder
yes.
you're such a fighter.
See, she is a
And,
fighter.
and
Yeah.
my
Wait.
and my trainer was a world champion, and
Wow.
I give her a lot of credit because she taught me a lot in how to use my energy in a lot of different ways of conditioning. And when I truly say that it's running a foundation, it takes a lot. Yeah, you have to be in shape. I have to stay in shape every day. I go walking every day, at least 3 miles, or I run half and half. But bottom line, to stay healthy, to stay active, to stay with that incentive, it's the people, it's the need, it's I don't look at what's around me. I look at what I'm doing. That's my focus. What am I doing for the people? What can we do for our environment, the individuals affected with kidney disease, or to help people stay out of this area of kidney disease? I believe in bringing awareness. People don't want to listen to me. They look at me saying, "Oh, that's not me." But bottom line, the energy comes from endurance of what comes my way. If I'm in the ring, that I'm going to build energy to fight the fight I'm fighting. If it's in the kidney world, this is the fight I'm fighting. And that's to find the answers for each case that's on my desk. And I literally leave the cases that are brought to me from transplant teams, social workers, wherever they come from, and a lot of referrals. I have them on my desk until I'm completed.
Wow.
That's when I take it off. So I'm very disciplined. I can say I have the love for people. And through, great women in my life, it's been an honor to have the love that I have for the community and for the individuals. And they don't always have to be kidney patients. It's a big world out there. I've seen so much in the last 13 years in the heart of the community.
Awesome.
So you got it out of me, Katie.
So we know you do a lot of work, but we also know you have an excellent team, and that you rely on them and you're so grateful for them. And so we'd like to just learn a little bit more about your team. And then also, we know that in some, communities, it's not normal to take healthcare concerns outside the family. It's more of a private matter that the family deals with. And I know I've been told that is the case in the Latino Hispanic community, and I'm sure other communities as well. Your team is very diverse, and somehow you have managed to reach these patients, even though there's some cultural barriers there. And I'm just curious what the secret to that success is.
Okay. Yes, you're absolutely right. In different cultures, there's very strong, personal, and they will not talk to anybody. But bottom line is listening. I find every time a patient comes in, they come in with somebody and somebody else that's talking for them a lot of times. But eventually, by them listening to the conversation and to the non-imposing and the conversations that are non-personal, just, how can I say it? Sometimes by them just seeing, it speaks louder than words of what we've done for people. For example, I've had a patient. She goes, "I'll just stay on dialysis. I'll be on dialysis, for the rest of my life. I'll be ready whenever." But bottom line, she had a great family support. But bottom line, it was coming to a point where, okay, it's too long. How come I'm not, getting called for the kidney? You know what? She ended up coming to me one day, and she's a great lady. She volunteers for the foundation all the time. And she goes, okay, Carol, I'm ready. But it took coming out of that family barrier, that confidentiality, to ask. Sometimes it takes the first time, sometimes it takes, but our team are all diverse. We have so many different cultures of volunteers, and that's not even the issue there. It's really the comfort they feel in of opening up and really seeing and believing in us, what we do. That's truly all I can say that really moves in patients, because I can sit in a room of a ton of people that I don't speak their language, but you know what they do feel? The love from my heart, the compassion that I have to help them. And all we need is that translator. Yeah, all I need is that translator involved. That's it. But we get our work done, and that's a beautiful thing. But that one patient that finally opened up and said, Carol, help me. Within time, working with her healthcare team, there was a very reluctant, he said, well, she's, I told her she has to do this before we can refer her to the transplant team. And bottom line, she didn't have to do anything. When it was time, I shared with the gentleman, who are we to say it's time for a patient's journey to take that next step? We don't know. She was ready a long time ago, but because of her plea, because she wanted it now, she goes, I'm ready, Carol, so let's do it. So bottom line, we got her to that next level, and she got her kidney that year, months later, because she was already over 10 years and she knew it was her time. So sometimes patients move themselves in this journey, but they just need that link to work with their healthcare team, because they have that barrier, that English barrier, that language barrier, that modesty, and one thing I do want to say is a lot of patients from minority cultures, they feel because of that language barrier that they can't speak up. They don't know. They lose that confidence of asking that question. They'll just sit there and wait for years and not ever ask a question, because they don't feel that they can ask that, or they don't know how to say it for them to understand. So that's what our staff truly understands.
Yeah, you help them find their voice.
Mm-hmm. And I think it's really powerful, probably for patients, to be working with someone who looks like them, who speaks their language, who knows their culture, because they know this is not some stranger who knows nothing about me. This is someone who understands me and, I can connect to. And the fact that you guys don't push the patient into a stage of their, of transplantation or any other treatment that isn't right for them, but you really wait for them to be ready. I imagine that builds a lot of trust, because they know that you're in their corner and you just want what's best for them and don't have any preconceived notions about what that means.
And the most important thing, if I may add, is it's their choice. I have patients that don't choose to be transplanted. I have people that they just say, nope, not interested. I'm good where I'm at, or either there's a fear. And if there's a fear, well, I wouldn't do that transplant either. So bottom line, everybody has a choice, or whatever choice they want in their journey. We somehow, some way try to help them get to that next step.
That's really powerful and exciting that patients have that resource, and someone who can personally help them through that, because from what I've heard from transplant patients, it can be a really big life change, a big shift in the way they're living and the way they're thinking. So
sure.
I would love to actually stay on this topic and talk a little bit more about transplant, specifically living donation. And I know you mentioned you guys do a lot of education with patients and their family members and friends, and neighbors about living donation, and if they're interested, how they can go that route. So just from my perspective, I'm really interested in hearing what kind of questions patients have about living donation. What are their fears or concerns, and what are the barriers that typically prevent them from either choosing it or, pursuing that route?
A lot of it is they don't want to ask. Patients tend to not want to ask anybody. But I'm going to share something with you. I know a dear friend of mine that I worked with for 13 years. And at the beginning of his end-stage kidney disease, we had a huge event. And that event, we got 7 living donors signed up to help him with the kidney transplant. And literally, we were giving them away, that live donor to help that person. And, we went in that way. But bottom line, kidney patients don't want to ask, especially their family members. And when we bring it up, you can, bring a quicker recovery and transplantation if you wish. But if you have any family members or friends, I can't ask. A lot of cultural individuals will do that. They will not take from their kids. They believe in giving to their children, not taking.
Right.
And life especially. And I've always shared that I know a woman that's had 9 children with 1 kidney. And if that woman had 9 children, anybody can survive with 1 kidney. So I always share this story with them, but whether it works or not, I don't know. But bottom line, patients don't want to ask, and they don't want to take an organ, especially from someone's life. And that is hard, especially in any world, I'm sure, cultural minorities, whatever. It's hard to ask for that. But there are a lot of people that step up and say, I'm going to give my kidney, whether you want me to or not. And those are the people. No, that's true. I've seen friends say, Carol, don't even, I'm going to go get tested. I want to see if I'm a match. And so, and even if that person wasn't a match, we have resources to get them to a transplantation facility that can do a swap. So sometimes it's a joy of a transplantation process, but sometimes that's the biggest barrier that we find, as they don't want to ask. So live donors, it's not that the live donor doesn't want to do it. Sometimes they won't take to.
Wow.
Do you find if you're able to engage the patient's family members or close friends in that discussion, the patient might be more open to it since they're not?
Oh, sure. Oh, sure. And we've seen it happen. We've seen it happen right between, I call it my war room, because that's where all this work comes from, right? My crying, my praying, whatever you want to say. We have a lot of patients that come in with their family, and even like the brother of one patient, he goes, I'm going to give my kidney to my sister. And she goes, no, that's okay. And I see that firsthand. And he goes, Carol, let's do the paperwork now. And so we'll contact the transplant team, get the paperwork done, we'll do it. And so it's really the way it comes in. And sometimes we have great opportunities to help that process, take into play of getting the transplant. Sometimes they just refuse. So
Again, it goes back to when they're ready, right?
yeah.
You have to wait till the patient is ready, and then they'll be on board, and they'll be, they'll do everything they need to do to make it as successful as they can. So
and sometimes patience is golden. I had this one patient. He had a lot of live donors, but he would not take. But bottom line, he ended up needing a dual transplant by the time he got transplanted. And that was just a few years later. So it was almost a blessing. He didn't just get the kidney because he needed both. So sometimes life just takes its toll. It's time for a reason.
Wow.
So I don't believe in pressuring, but I do share all the possibilities. and
Yeah.
all the great things. And we have events we've had live donor 5Ks. We've had a lot of awareness of becoming a live donor events in the community to educate, to let them possibly be interested in being a live donor. And I kid you not, there was one event we had, more kidney patients came just to see who wanted to donate their kidney because they had interest. So bringing out that event brought out, I go, oh, so she is interested in getting a transplant. Oh, so if she had a live donor, she would take it, but it couldn't be her family. That's what it was. So it's interesting. It's interesting, a mother or sister. It's just different scenarios.
Yeah.
Yeah,
We have a couple. Oh, sorry.
Go ahead, Katie.
Oh, I was just going to say we have a couple questions that came in from the Q&A. And one of them is directly related to the live donor. And that is, what tests are performed to determine a match? Like
HLA, blood typing, right?
Oh, do you know?
I can probably answer this one.
Yeah.
I'm not a scientist or a transplant clinician, but for those of you who might be curious, when a live donor and a recipient candidate, when the transplant team is looking to match them, they test blood types. It's called ABO typing. They do something called HLA typing, and there's various methods for that, but basically looking to make sure that they are to some degree a genetic match, and you don't get immediate action once the organ is transplanted. And they do something called antibody testing to make sure that the recipient isn't carrying antibodies that would cause their body to react to the transplanted organ. And there's a final test called a cross match. And that's something they do at the 11th hour to make sure that everything's good. The transplant team feels really confident that this is going to be a successful transplant. And I believe there's other parts of the process that's done with the transplant coordinator to ensure that the living donor is healthy and is not going to be harmed in any way by the surgery. That, if there are any financial concerns, that that's not going to be harmful to the candidate or the donor at all. We want to make sure that the donor and the recipient are fully on board and everybody is likely to come through feeling good and it's being a successful transplant. So there's a lot of different tests and discussions that go on, but if it all goes well, living donor transplants can be very successful. So
wow.
Huh?
And for those that aren't aware, the business that Molly works in, the Transplant Diagnostics business at Thermo Fisher Scientific, is here to help when that transplant. I'm sure I don't know everything, but I know once the transplant has happened, to ensure that kidney is not rejected, or to help ensure that doesn't happen. Correct?
That's true. Yeah, it's something we feel very strongly about. We're really proud to do.
Yeah. A couple more things about transplants here. Can a woman recovered from breast cancer donate her kidney? Is there any issue with that? Do either of you know?
I'm not sure. I'm not familiar. I would say if you're interested in donating, or you know somebody who needs a kidney and you feel moved to donate, I would talk to that person and have them put you in touch with their transplant team. It may depend on your particular case and who's the right, compatible candidate for a live donor. Can be a very complicated decision. So I wouldn't rule yourself out until you talk to the transplant team.
And it looks like actually someone from our Q&A answered that question themselves. And so thank you, Deanna, for answering. She says they must be 5 years clean of the cancer, clear of the cancer. Okay.
Yes.
Thanks, Carol, for confirming that.
That's actually for the recipient or the donor. The 5 years,
That's good
Awesome.
information.
that's
Yeah.
very important.
And since we're running out of time, Deanna also had a question previously that I wanted to get to. So she says she's a person with end-stage kidney disease, and she says, I agree that information is hard to find, and she's learned more from her fellow patients with her condition than anyone else. And she says, how can she get help for her fellow patients at her dialysis center, or help for her own self in contact with your group, Carol? She's in Texas.
By my email, I'm sure that you'll be showing that. The email,
Yeah, let's actually show that now. Let me share my screen.
my phone number. I take calls from all over. We take our contacts every call is important to us. There's not a person that's not important to us. So this is the information. I would suggest just to email us. You can go on the website, but my phone number is 818-521-6348. If you need that.
Carol, you're so generous.
Yeah.
You know what?
and
I just
while we're on
believe patients look for direct contact.
That's awesome.
They don't want to go on a website. And I find a lot of kidney patients just don't feel good enough to be emailing. They just want to, sometimes texting is easier now too. So
Yeah.
if
While
you
we're on
email
this-
me, I'll give you my number.
While we're on this topic, I just wanted to mention that if you are interested in donating to Carol's foundation, to the Kidneys Quest Foundation, you can either, if you're not a employee of Thermo Fisher Scientific, you can visit her website here, and it'll give you some direct links. If you are a Thermo Fisher employee, you're probably aware that we have a great matching donation program. So if you go to our charitable donation portal, you can just simply go there. We can share the link on Yammer where you probably found this information. But you can go there, search for Kidneys Quest Foundation, and we will match your donation so that your money will go even further. So
Thank you.
We also have a comment here from Aaron Acevedo. He writes, I love you, Mom. That's my hero, changing lives since I knew what a hero was. So love that so much.
Well,
We
my children are the one that take the biggest impact. Share them on with the world.
Well, it sounds like they're inspired by you, which is probably the best, most rewarding thing you can get out of all the work you do with your foundation. I think we have time for maybe one or two more questions. Katie, I think you had a great question about Carol's experience as the founder of this nonprofit.
absolutely. So at Thermo Fisher, we have these great groups called employee resource groups. And Molly is here representing the Women's Employee Resource Group. I'm here representing the Latino Hispanic Heritage ERG. And, we were just wondering if, starting a nonprofit or advocating in the crazy world of healthcare, did you have any specific challenges as a woman or as specifically a Latina woman? And can you, give any advice to someone who is a woman who's interested in starting something like you did?
It's hard work. It takes years and it takes several different teams, but all I can say is the word fear is not in my vocabulary. It's being a minority. First of all, yes, it's been a different world. It's been around a long time, and I've seen a lot of things in my life. But bottom line, it's determination. It's being in a cultural world. It's been more determination and knowing I can do it even though I never tried. And with that, I've taken every challenge with knowing that I'm going to give it my all. I'm going to do everything it takes in the right way to make, and I believe of establishing anything I do in concrete from the bottom all the way to the top, no matter how long it takes me to get there, as long as I started with the concrete foundation. and knowing what I wanted and knowing that I was never going to stop. And that takes dedication, determination. And with the healthcare, it's too big. It's too big. You can be part of it. You know, I found that we could be part of it. And a lot of people look at what our foundation does as definitely not a moneymaker, but you have to have a heart and compassion for what we do. And this is truly what our foundation is about. And with that, everything comes later. But you have to be patient and you have to have understanding. And it's just a lot of work. But never give up. I don't give up. I'll find the combinations
We can
to
tell.
make it happen.
Yeah.
We want
Yeah.
you on our team, Carol. Incredible.
Fantastic. Well, Carol, thank you so much for chatting with us today. More importantly, thank you for the amazing work you and your team are doing to help patients and their families. It's clearly much needed, and we love your passion and find it very inspirational. For anyone out there who wants to support the kidney disease community, as Katie mentioned, you can check out the foundation at kidneysquestfoundation.org. You can get involved by volunteering your time, donating, or spreading the word about the incredible things that this foundation is doing. Thank you to everyone who tuned in today. We hope you found this informative and inspiring. I know I did. I think it's awesome. Carol is a former kickboxer, and I love your fighting spirit, Carolyn, so it's been great to have you. This presentation was recorded and we're going to share it on Yammer. It will also be available soon on our YouTube channel. So this concludes our webcast. Thank you, everyone, and have a great rest of your day.